Hello there. This is Alejandro Gomez performing his 102 criteria for the knee trigger. We're going to be looking through the AP projections of the knee as well as the AP oblique with medial rotation and the medial lateral projection of the knee. So first, the criteria for the AP knee is that we're going to have the patient fully flexed, fully extended leg. There will be no rotation because no angulation because the patient is between 19 and 24 centimeters. So it's going to be pretty much perpendicular with the bucky. We're going to be seeing there's going to be no rotation in the knee. This can be evident by the femoral tibial joint, which is completely open. We're also going to see no rotation because the condyles are both symmetrical with each other. The patella is superimposed over the femur. And we can also see a clear view of the intercondylar eminence, as well as the tibia superimposing over the head of the fibula. Again, and the central ray, of course, is half an inch inferior to the apex of the patella, which is pretty much this section right here. The next projection we're going to be looking at will be the AP oblique projection of the knee with medial rotation. Now the rotation is going to be about 45-degree angles. It's going to pretty much give us, it's going to be the same central ray, which is again 1 inch inferior to the apex of the patella, except this time it's going to open up one particular joint. Again, there's no angulation, but in this case, we're going to have the, we'll be looking on the lateral side of the knee, showing the lateral condyles for the femur as well as the condyle for the tibia. This projection will also give us a more clear view of the tibiofibular joint, which is going to be right here. It's going to be completely open, nothing superimposed over that. Of course, we are going to have see the medial side of the patella right over here as well. And it's because it's rotation, the medial side will be superimposed by the femur. Moving on to the next image will be the lateral projection of the knee. And again, we're going over the medial lateral projection. So the patient's going to be on their side in a true lateral position. Of course, the patient will be laying down. In this criteria, both the condyles are going to be superimposed over each other. We're going to have a open patellofemoral joint, which is right here. And of course, we're going to see a full view of the patella, which is right here. There's going to be, again, some some imposition of the tibia over the head of the fibula. And of course, our central ray is going to be a little bit different. It's going to be about 1 inch distal to the medial epicondyles, which is going to be right roughly around here section. And again, our patient is going to be on the side, so we're going to be seeing like the medial side superimposed over the lateral side, as well. Similar open joints. Well, not as much open joints, but again, open joints of this area. Okay, this is Alejandro performing the last x-rays for the knee trigger. We're going to be looking at the next image, which right here is going to be the AP axial projection of the intercondylar fossa using the Beclaire method. Now the central ray is going to be focused about 1/2 inch inferior to the apex of the patella. and the knee, the knee is going to be bent about 60 degrees. Now, the criteria for this method or this projection is we're going to see an open intercondylar fossa. So this section right here, we're also going to be looking at the posterior inferior surface of the femoral condyles. And again, we're going to be looking at an open knee joint and an open intercondylar fossa, which is pretty much this section right here. We're also going to be, there will be no superimposition of the apex of the patella over the intercondylar fossa. So there's nothing in the way right here where the patella would be in the intercondylar fossa. And there will be no rotation of the tube, evident by a slight imposition of the tibial fibular joint. So right here, there's the slight imposition showing that there's no rotation. Tibia will be over that joint. And the very last criteria we're looking at is going to be the tangential projection of the patella and femoral joint. The central ray for this one is going to be perpendicular to the knee joint, and it's going to be centered on between the patella and the femoral condyles. Our criteria for this one is going to be the patella in full profile. We're also going to be looking at the femoral condyles and the intercondylar sulcus, which is going to be this section right here. But above all, we're looking for an open patellofemoral joint, which is pretty much this whole section right here. This section right here is going to be completely open, no rotation, no superimposition. It's just going to be completely open. Right? Thank you very much.